your first patient, so what in the world are you supposed to do now? The thing that you want to do is review your patient's chart. Look at their disease process. Look at their health history. You want to ask yourself, is there any family members? Ask someone, ask your preceptor, is there any family members present in the room? If so, is it okay if you discuss their health history with their family? You want to also look at their chart for any medications. What medications are they on? What medications will you be expecting to pass out? Do you know anything about these meds? If you know nothing about these medications, then look them up in your nurse drug book. Are there any contact precautions? Do they have VRE or MRSA? Any of those things. Also, that'll be posted on the door, on the patient's door. Are there any fall precautions? Have they fallen before? Those are some things that you also want to look at when you're entering the door. Also, talking about the door, you also want to review the patient's name on the door, because there was an instance where a wrong name on the patient's door. That was not the patient. They totally screwed that up. So make sure you look at the patient's name on the door before you even enter. So when you enter, you're going to check that name against their wristband. You're going to also ask them their name to verify that that is the correct patient. That is very important. So, but before you even enter that room, you're going to wash your hands. Go ahead and wash your hands before you go in. Knock on the door before you enter. Wait 3 seconds. You want to give your patient their privacy. They're in the hospital, but yeah, you want to give them privacy. Put on your gloves when you enter the room. So, and after you put on your gloves, then introduce yourself. Usually I say, hi, my name is Teresa. I'll be your student nurse today, and I'll be such and such. Whatever you're going to do with them. Usually it's going to be like head to toe assessment or taking their vital signs. So introduce yourself. Once you've introduced yourself, then you're going to identify the patient. You ask them their name, their date of birth, and check it against their wristband. And then after that, you want to provide privacy for your patient. That includes just pulling back the curtain in the room to give them that privacy. You want to do this even if they're the only patient in the room, because you never know who's going to come barging in that room. So make sure you pull the curtains to give them their privacy. You explain what you're doing. So I can't stress this enough. You don't want to get in there and start doing your head to toe assessment and start taking vital signs without telling your patient what you're doing. So explain to them what you're doing and ask them if they have any questions about it. And you also want to ask for permission. Is it okay if I touch you? Because there are some, there may be a case where they're not comfortable with you touching them. So ask them. So after you've explained what you're going to do, you're going to go ahead and take your vital signs, which includes temperature, blood pressure, and respirations. Also, you want to do a pulse ox. Here's another important tip. You want to ask them, are you in any pain at all? If they're in any pain, they're probably not going to cooperate with you. Ask them if they're in any pain and do the pain scale. From 0 to 10. With 0 being no pain at all and 10 being the most pain you've ever felt. What is your pain scale? And they'll tell you. And if they're in a lot of pain, then review their chart. Do they have any pain meds? If so, get with your preceptor and see about getting them some meds for the pain. When you enter that room, be confident. I know you might be nervous and scared, but that patient is not going to want you near them if you're kind of nervous. And so make sure you have confidence. Do your empowering pose if you have to. Anything that helps, do it. Because you want to make sure that your patient is comfortable with you and you're building rapport. Remember, you're building trust with that patient. They're not going to trust someone that is nervous. So be confident. So make sure you take your vitals first before you even start your head to toe assessment. Watch their position before you even do your head to toe assessment. Raise that bed up at least to waist level. Raise it up to waist level. That way you're protecting your back. Did they bring any items of value into the hospital with them? Jewelry, watches. Do they have any glasses? Do they have any dentures? This is very important. You want to make a note of these items. Do they have any hearing aids? That's very important because they're going to need to hear you. So if they have hearing aids, you need to help them put their hearing aids in if they can't do it themselves. Also, have they relieved themselves? You know, it's going to be real difficult for them if they have not used the restroom and you're palpating the bladder. Not a good situation at all. So make sure that your patient has relieved themselves before you start your assessment. I hope you enjoyed this video. If you did, hit the like button, leave a comment below, and subscribe.